Yeah, thank you, Dr. Sahani sir, and good evening, good morning, good afternoon to all of you from Philippines. And we begin the new session of International Forum for Promoting Homeopathy. Before we proceed, we will have 1 minute silent prayer. Thank you. So today we have uninterrupted 1710th day of our daily uninterrupted Zoom meeting in a history-making process. And today we have as our guest Dr. Guru Kiran from Bangalore, for Karnataka, and Dr. Guru Kiran is going to present on the topic blockbuster remedies. So, and Dr. Guru Kiran graduated from Government Homeopathic Medical College and Hospital, Bangalore, affiliated to Rajiv Gandhi Health University of Health Sciences of Karnataka State. He is a classical homeopath practicing in the Chamarajanagar in the state of Karnataka. He has 17 years of experience. He is an independent researcher and post-graduation fellowship in the SCPH, International Center for Homeopathic Medicine, United Nations, presented papers in homeopathic approach on the treatment of different type of cases, especially psoriasis, thyroid problems, PCOS, epilepsy, hypertension, respiratory disorders, parahemoglobia, GERD, alopecia, infertility, etc. So, hello.
Hello.
Okay.
Yes.
So we welcome Dr. Guru Kiran for the presentation today. We will have at least 10 minutes for discussion also, Dr. Guru Kiran. So over to you for your presentation.
Yes. Thank you, sir. Thank you for the warm welcome in this IFPH platform. I'm going to present it. Are you able to see my presentation?
Yeah, it's there.
Okay. Okay, then. Yes, as I said, today's topic is blockbuster remedies. So, agenda for today's session to know about blockbuster remedies, when to use these blockbuster remedies, what are the guiding indications regarding blockbuster remedies, and rubric selection. How can we see in this repertory? So this will be the agenda for today's session. Let's see. So what does it picture say? There are two parts in this slide. So what does it picture say? Anybody who wants to respond, they can type it in the chat box. What does it picture say? See the picture in this right side of this, it shows jumbled colors, jumbled thing, different colors, different shades. And we as a homeopathic physicians, we have to observe keenly and pick the right symptoms, the right rubric selection. It will lead to the simillimum. So we have to be very careful and keen in observing the patients while receiving the case. So moving to the main topic, gratitude to the master, Dr. Samuel Honeyman. With all his blessings, we'll go further. Yes, what does this picture say? The way to get started is to quit talking and begin doing. That's what Walt Disney said. Let's start with the introduction. Blockbuster remedies are those which can be used for positive, also which helps in curative aspects of a case. This is what blockbuster remedies mean. So, the first remedy for today's session is Aristolochia clematis. I'm not aware of this medicine. Let's see how can be used and what are the rubric selection which leads to this Aristolochia. What are the guiding indications of this remedy? In the today's session, I'll just present only the guiding indications. For any details, you can go back to Materia Medica and you can have details of this remedy. Only the guiding indications and which is clinically used, which is clinically helpful in rubric selection or for the prescription. Eczema of the varicose veins. If there is varicose veins and there is eczema on it, think of Aristolochia. Symptoms of sneezing on waking, especially by 8 to 9 a.m., we can think of Aristolochia. And inflammation of the middle ear with noises and pain. Vertigo on leaning forward. It's a characteristic symptom. And incontinence of urine in old women. Prolapse of the rectum from tenesmus. These are all the very good guiding indications which leads to the remedy Aristolochia clematis. Especially in geriatric group of cases, lot of people comes to the clinic having incontinence of urine after 70 plus 75 years of age. We can think of Aristolochia. And hoarseness of voice with tonsillitis. When there is a patient present with the symptoms of hoarseness of voice, pain in the throat, when we examine the throat, if there is tonsillitis plus hoarseness of the voice, think of this remedy Aristolochia. And especially I use this remedy for female complaints. Especially in PCOS cases, it helps beautifully. Amenorrhea due to flight, in prison, camps and traveling. If there is any case which comes after traveling, there is amenorrhea, think of Aristolochia. Chilliness at night during menses. Sleep bad before menses. Joint pains, especially due to seeming, pregnancy, think of Aristolochia. And varicose congestive legs, menses before. See all the complaints associated with menstrual troubles. You can think of Aristolochia. Tired leg, better from menses. Inflammation of the joints, aggravation menopause. Varicose veins, aggravation, menses. Menses delayed and prolonged. Especially, this is a very good entry point to the case. I use lot of cases for Aristolochia for these kind of complaints, especially in PCOS cases when there is a delayed menses, tardy menses, and which is prolonged. Still 2 to 3 months, the menses has not appeared. So you can think of this remedy, Aristolochia, especially in PCOS cases. It works wonders. And sterility women, especially after marriage, there is no issues. And if the patient is having PCOS, there is sterility, definitely you can think of Aristolochia. And leukorrhea before menses. This is a very common symptom that we see in our clinics. Sir, once before the menses, there is leukorrhea. Think of Aristolochia. I use usually in low potency. Aristolochia 6 we can use for daily dosage or 30 potency. Where can we see in this? In the repertory, that is complete repertory, it gives menses suppressed or absent. Aristolochia clematis is one of the remedy. There is phosphorus also. Can think of Aristolochia. In lower potencies, it is very helpful. So what is this remedy? Next, move on to this second remedy. Abroma augusta. There is one specific rubric for this. Abroma augusta. It is helpful in diabetes cases. Empty hollow sensation. Pressing pain in lungs, forced back as if. This is one of the characteristic remedy. This is one of the characteristic symptoms. Desire for fish, sour food, extreme thirst, extremely thirsty remedy. And which is useful in albuminuria. If you go to the repertory and type urine albumin with Abroma augusta, the single remedy which comes up. So if patient is suffering with albumin 3 plus, 2 plus in the urine, please think of Abroma augusta. It works wonderful. I have tried this Abroma augusta in a case where having 3 to 4 plus of albumin in the urine, drastically it has reduced after giving Abroma augusta. See, these remedies are what I am presenting today is, as I said, is blockbuster remedies. All are short-acting remedies. So lower potencies you can repeat frequently according to the dosage, according to the patient's susceptibility. So go for low potencies so that you can repeat the dose. If there is a characteristic symptom entry point, and if you are confident enough, if you want to give higher potency, you can try also. No doubt in that. But usually I prefer to go in lower potency so that I can repeat the dose whenever it is needed. And these blockbuster remedies can be used as intercurrent also. After giving constitution remedies, when there is a paucity in the symptoms, when there is a paucity in the progression, you can think of these blockbuster remedies as an intercurrent thing. Yes, what is this? Castor equi. This is the rudimentary nail of a horse. Castor equi. I think most of the doctors has used this remedy. I have used this remedy and it has given me wonderful results. What is this? Can anybody say this? Can anybody chat? Type it in the chat box. What is this condition? Yes, any chats? Lichen planus? No. Stomatitis? No. It is psoriasis linguae. Tongue psoriasis. Psoriasis linguae. So one of the remedy for psoriasis linguae is Castor equi. And cracked and ulcerated nipples. For this I have used intensively in my clinic. In the nursing mothers, where there is a cracked and ulcerated nipples, where babies used to bite their nipples while sucking the milk. After that, they will be presented the symptoms of these kind of cracked nipples, which is very painful for them. and it will be difficult for them to feed for the babies. In this case, Castor equi works wonders. Within a day or two, problem is solved. On the warts on forehead, warts on the breast, violent itching of the breasts, areola reddened. For all these conditions, Castor equi works beautifully. So where can we see in this? Murphy repertory, breast, cracks, fissures, breast, nipples, nursing during. See the remedy, Castor equi. Ratania also comes, but Castor equi works beautifully. I have used intensively in my clinic this remedy for these kind of conditions. And another thing, tongue eruptions, psoriasis. Another remedy is muriatic acid. So Castor equi, Boric has also written in italics for psoriasis linguae. Sure short remedy. And also muriatic acid. But do not forget the remedy Castor equi. So move on to the next remedy. What is this? This is Cholesterinum. Have you ever used this remedy? Cholesterinum is a nosode which is found in blood, brain, yolk of egg, seeds and buds of plants, bile and biliary caliculi. This is the source for the Cholesterinum. For the cancer of the liver and obstinate hepatic engagements, gallstones, one of the triable remedy in gallstone cases, biliary caliculi cases. Cholesterol is the physiological opponent of lecithin. And for coronary insufficiency, if there is no clear-cut indications for coronary insufficiency, directly you can prescribe Cholesterinum 30 for coronary insufficiency patients. If there is no any other clear-cut indications, you can think of Cholesterinum. It acts beautifully. One of the major remedies for gallstones. I use intensively for gallstones in my clinic. Cholesterinum 30 so that you can repeat the dose. If you want to go higher, based on the susceptibility of the patient, according to the confidence of the physician, you can or you cannot repeat the dose according to the cases. So I prefer lower potency so that I can repeat the dose whenever it is needed. What is this? Anybody? By seeing the picture? Anything you want to chat? Yes, eel. Dr. Asina Mohammed says eel. Yes. This is serum anguillae or eel serum. The common name is eel serum. What can you find in Mater Medica is serum anguillae. Kidney affected either from cold or infection or intoxication. Characterized by anuria, oliguria and albuminuria. All the three. Eel serum remedy re-establishes diuresis and rapidly arrests albuminuria. Acute nephritis with threatening uremia. Mitral insufficiency, dyspnea with difficulty urinary secretion. Hypertension and oliguria without edema. This is the characteristic indication of eel serum. Any kidney failure cases or acute renal failure cases without edema, think of eel serum. It works wonderfully. I have presented a case in this platform only long before about a case of emphysematous EPS, emphysematous pyelonephritis. It's a case of emphysematous pyelonephritis grade 2, which has been revived by this single remedy, yield serum. Also, patient was on insulin dependent and also having mitral insufficiency. All the three was covered with this beautiful remedy, yield serum. Yield serum 30 was given within 15 days. The patient revived. Toxic action on the blood, especially destroying globules. Primary disease of the kidneys with hypertension, oliguria, and without edema. This is the key. This is the PQRS of this remedy. It should be without edema. How can we see in this repertory chart? Kidney failure or inactive. One of the remedies is serum anguillae. Also, I can think of EPIS. For EPIS, where there is edema. Serum anguillae without edema. This is the characteristic entry point to this remedy. I have used serum anguillae in lot of cases, kidney failure cases without edema. It works beautifully. That should be the entry point for this. That case, what I had told you, emphysematous pyelonephritis grade 2, which was having all the three. Kidney failure was there, mitral insufficiency was there. Also, he was having diabetes insulin dependent. After giving this yield serum, the insulin was stopped. The mitral insufficiency was greatly improved. And also the acute renal failure also, he came back from that. He revived beautifully after giving yield serum. This is Folliculinum. This is one of the blockbuster remedies in my clinic. Folliculinum is a sarcode. Leukorrhea during ovulation. Griping pain during menses. Especially, we see women come to the clinic. There's a lot of griping pain during menses. You can think of folliculinum. Also, uterine hyperplasia. It's a very common now. Endometriosis. Lining, endometrial lining inside the uterus. Thickened, 15 mm, 20 mm. You can think of this remedy, folliculinum. Leukorrhea between menses. You can think of folliculinum. This works wonders in female troubles. And also menses absent, amenorrhea. This is the key for folliculinum. I have used extensively this remedy in also PCOS cases, where stoppage of menses for 6 months, 8 months, 9 months. Especially, you can think of this remedy where there is an abuse of taking this postponed tablets, postponed hormone pills. Sir, for this function, I have taken this postponed pills. For my marriage, I have taken this postponed pills. After that, I have got imbalance in my periods, imbalance in my cycle. There is no menses after taking this hormone pills for few months. Think of folliculinum. I give folliculinum 30, single dose. Within 2 to 3 days, the menses appears for the women. Beautifully it works when there is these kind of indications. And menses irregular, too late. It's a very handy remedy in PCOS cases where there is a block. It's a blockbuster remedy. And sterility. This is also very important. In sterility cases in women, due to PCOS or some other problems, in the clinics after getting married, 4 to 5 years, there is no issues. Think of folliculinum. You can commence the treatment with folliculinum in the clinic. If there is any positive or if there is any clear-cut indications, if there is no clear-cut indications, think of folliculinum. You can start with the lower potency and you can come back. Whatever it is has to be given to the case after that. It's one of the beautiful remedies. And also, Fibroids in the uterus. Amenorrhea, again, what I said, from lot of days for 8 to 7 months, 8 to 9 months, there is no periods. Amenorrhea, lot of medicines they have tried, lot of hormone pills they have tried, still there is no use. Think of folliculinum. And one more key point I should give you in this session is, I have used extensively this folliculinum in 30 potencies. For the second time or the third time, if the problem reappears, there is any blockage, there is no good progression, again there is a breakage of cycle, there is amenorrhea again. Folliculinum 200 works. If that exhausts, folliculinum 30 exhausts, think of folliculinum 200 at that time. It also works wonderfully, that potency. And metrorrhagia. Metrorrhagias, again there is a flow between the periods. And ovarian tumors, cysts, especially in PCOS cases or any other tumors. Think of folliculinum. Due to abuse of those hormone pills, there is formation of cyst. Again, think of folliculinum. Dysmenorrhea, it's also a wonderful remedy. In the repertory chart, tumors, fibroma, myoma, ovaries, there is folliculinum. Also one of the remedies, lachesis, you can also think of folliculinum. It's a sarcode. What is this? Balsam, called as Gnaphalium. How many of you use this remedy, Gnaphalium? I think many of the doctors has used it. I know it's a wonderful remedy in which cases? Sciatica. Lumbago associated with numbness. Sciatica right side. This is the characteristic entry point for this remedy, Gnaphalium. I have to say one case that a boy of age around 17-18 years, college boy, who is suffering with sciatica, especially right-sided, he has been up to a lot of corporate hospitals without any relief. He has done MRI scan also. No relief at all. Sciatica right side. So he came to me, have given this remedy, Gnaphalium. Wonders, within a matter of 2 days, he was better after giving Gnaphalium. Cramps in cough and cramps in the foot. Think of Gnaphalium. Chronic backache in the lumbar region, especially LS spine, lumbosacral spine. Think of this remedy. And modalities are aggravation lying down, aggravation stepping, aggravation motion, amelioration by flexing leg on the abdomen, amelioration by sitting with bended knee. So think of this Gnaphalium. So all the modalities, characteristic modalities. Especially if there is a case of right-sided sciatica, Gnaphalium shoe shot remedy. So it's clear cut in the repertory. Pain, sciatica, right side, or pain, sciatic nerve, right side. Gnaphalium is the leading remedy. Outstanding remedy is Gnaphalium with 4 marks. So you can think of Gnaphalium. A lot of cases in our clinic, sciatica cases nowadays. If there is a especially right-sided sciatica, think of Gnaphalium. So next remedy is Insulinum. It's again a sarcode. Especially in diabetes cases. It's a blockbuster remedy. If there is a paucity, if there is a block in the progression of the case, especially in diabetes cases, 1 dose of Insulinum brings back the case. restores the lost ability of carbohydrates and stores glycogen in the liver. This is the action, modus operandi of insulinum. Enlarged liver with suppurative condition. Liver enlarged but not painful. Polyuria with boils, especially if there is a successive boils in diabetes cases where there is an association with polyuria, think of insulinum. Case of persistent skin irritation, boils as I said, varicose ulceration in diabetes cases, polyuria, erythema with itching eczema, think of in our OPDs having boils in diabetes cases, successive boils. After one boil, again within few months, again reappears. The boil reappears, successive boils. So one dose of insulinum brings back the case. We can give in both the potencies. If there is a requirement of repetition, can go for lower potency, insulinum 30, or if there is a clear-cut indication, can go insulinum 1 one dose. Next case is, what is this? Flower. Justicia adhatoda. Especially in respiratory disorders. Coryza with cough. And cough with sneezing. Patient may present to you with, sir, there is a lot of cough, also with sneezing. Think of Justicia. And dryness of mucous membranes. Habitual constipation. Long-standing constipation cases where there is a habit of constipation, think of Justicia. And coryza with loss of smell and taste. This we have experienced in COVID. Post-COVID. Also, there is a lot of cases now also coming up with these kind of symptoms. So after having fever with cold and coryza, there is loss of smell. There is loss of taste. You can think of Justicia. I have used this remedy in lot of these kind of cases, especially after viral infections, after fever, there is loss of smell, anosmia, lot of taste. Think of Justicia. And paroxysms of suffocative cough. Rattling in chest with no expectoration. Patient may, but there will be no expectoration. Think of Justicia, especially in old age people, where there is history of smoking. Smoking, there is rattling chest without any expectoration. They say it's very hard to expectorate. Only cough comes with paroxysms and with rattling sound in the chest. What a beautiful remedy is Justicia adhatoda. Asthma, aggravation midnight, aggravation exposure to dust, aggravation exposure to gas. Think of Justicia. And remedy for acute and chronic catarrhal conditions. Catarrh descends into bronchi, where patients tell you that it started with the catarrh and it is now in the lungs. I can feel that it has gone down. Catarrh descends into bronchi. Can think of Justicia. See in the repertory, coryza, cough with, as I said, and loss of taste and loss of smell. Both the things are there. Stricta also comes, strictopulmonuria. So one of the wonderful remedy again, Justicia. I have used this Justicia in my clinics with lower potencies, where there is asthma attacks in the midnight, there is exposure to dust, exposure to gases. You can think of Justicia. One dose at the time of aggravation, it will calm down. And nowadays, last month also I have treated 4 to 5 cases after viral fever with coryza and all. There is loss of taste and loss of smell. Not even a strong smell of asafoetida they cannot smell. If asafoetida is there in their houses, if they start to smell, they cannot identify the smell of asafoetida. Think of Justicia. And Stricta with nose obstruction. Again, there is a loss of taste, loss of smell with nose obstruction, without any coryza, dryness of the nose with obstruction, Stricta pulmonaria. It works beautifully. Which is this remedy? Beautiful flower is Pareira brava. This is one of the blockbuster remedies in renal colic. Very, very beautiful remedy in renal colic conditions and prostate affections. Bladder catarrh, urinary bladder catarrh. This is the key. This is the PQRS of this remedy. Can emit urine when he goes down the knee, pressing the head firmly against the floor. When the patient goes to this position, only then he can emit some urine. Only then he can pass some urine. This is the characteristic entry point. And which is urine is black in color. Urine is bloody, foaming. And think of Pareira brava. And urine ammoniacal. The patient complains of this ammonia smell. Think of Pareira brava. With large quantity of viscid thick white mucus while urinating. Cramps in the legs on attempting to urinate. Again Pareira brava. Left-sided renal colic. This is the entry point, PQRS, left-sided. If the patient complains of renal colic of left-sided, think of Pareira brava. It's a blockbuster remedy in these kind of cases. The repertory: pain, left colic with kidneys, renal colic with left side. Another remedy is Berberis, Berberis vulgaris. Especially there is cramps, severe, very severe. There is a cramp. Think of Pareira. Which is this beautiful yellow flower? Sinapis nigra. Stoppage of left nostril. Nostrils alternately stopped. This is the entry point for this remedy. The patient complains of there is a nose obstruction only in the left side. Think of Sinapis. And also they say that, sir, one side this time, again this time, think of Sinapis nigra. Nasal polyps cases. Especially aggravation to fat and rich food. Aggravation from mustard. It is made up of mustard only. Sinapis nigra is a mustard. Aggravation due to mustard seeds. Aggravation 6 to 9 p.m. Hay fever in summer. Think of Sinapis. Obstruction of the nose alternating side. As I said, If there is obstruction of the nose, alternate sides, think of Sinapis. Cough, amelioration, lying down. Most of the remedies are cough, aggravation, lying down. When there is a case, cough ameliorates by lying down, think of Sinapis. This is the PQRS of this remedy. Offensive breath like onions. Breath is offensive as if he has eaten onions. Sinapis. Aversion to sweets and sugar. Again, Sinapis. Mustard oil inhalation acts on sensory nerve endings of the trigeminal nerve. Relieves pain in the middle ear disease. Painful condition of nasal cavities and tonsils. Mucous membranes of the nose is dry and there is no discharge. Think of Sinapis. The repertory, nose, obstruction, left. Sinapis nigra is the outstanding remedy there. With 4 marks, the complete repertory. So these are all the blockbuster remedies. When there is a paucity, when there is no clear-cut indications in the case, only these kind of symptoms are presented in front of you. Think of these kind of remedies. It brings back the patient. What is this? Remedy called X-ray. X-ray is imponderabilia. So cancer with ascites, distressing pain. Sorry, cancer with distressing pain. Atrophy of sexual glands, especially the remedy for atrophy of sexual glands, especially ovaries. Sterility in male and female also, for both of them. In anemia, leukemia cases, bone marrow depression cases. Stimulates cellular metabolism, arouses the reactive vitality. Sneezing with sensation of sulfur vapors. If any case having these PQRS symptoms, sneezing with the sensation of sulfur vapors, think of X-ray. Cataract, in cataract cases, opacity of lenses. Stools green colored. And especially gray-green discoloration of the teeth. If you observe these conditions when patient is talking or laughing in front of you, if the patient's teeth has discolored with green color or gray-green color, think of X-ray. Inflammation of the lungs, mammae and pericardium. Sorry, 1 second. And milk absent in nursing mothers. Can think of X-ray. These are all the very important guiding indications. Green and profuse bleeding during menses. Again, there is a green discharges, green discolorations. Think of X-ray. Absent menses in Engels. You can also think of in PCOD cases. Sterility, again in the women and in the men. I have used extensively X-ray remedy in sterility of men cases. I have given this remedy as an intercurrent remedy with the constitution. It works wonderfully. Tumors of uterus and fibroid. Burns from X-rays. Ailments after exposure to sun. This is a very common ailment, what we see. So there is a discoloration of the skin. There is a burn mark after exposed to sun. Think of X-ray. And electric shock-like sensations. When there is a patient present with the symptoms of electric shock-like sensations in the body, think of X-ray. Wonderful remedy. Where can we find in the repertoire is atrophy ovaries. X-ray. What a beautiful drug it is. We have to make use of this remedy, X-ray. Lot of cases in hormonal disturbances cases, especially infertility cases. X-ray works wonderfully. Let's move to the last remedy for this session. What is this? As we all know, gingiber officinalis, commonly called ginger. Complete cessation of the kidneys. I have used in a lot of renal failure cases. It brings back the function of the kidneys. And also from complaints from eating melons and drinking impure water. Now it's a summer season. Lot of cases comes ailments after eating watermelons, muskmelons, and also by drinking impure water. Think of gingiber. Asthma without anxiety. Usually asthma patients get anxious. In this case, patient will be suffering with asthma, but there will be no anxiety. Think of gingiber. Ailments from eating melons. Ailments from eating bread. After eating bread, there's any ailments, think of gingiber. How we can apply to the Indian conditions? Eating any rotis made up of any maidas, roti, naan, and all, butter kulcha. After eating all those things, any ailments, think of gingiber. Useful in acute renal failure cases. Anus is red hot, inflamed, sore and painful. Think of gingiber. Urine is thick, turbid of strong odor. States of debility in digestive tract and sexual system. Taste of food remains long of bread and toast. Think of gingiber. If there is any characteristic entry point as this, think of gingiber. Where can we find it in repertory? Food and drinks, melons, aggravation, gingiber with 4 marks. Wonderful remedy for this summer season. So thank you for the patient listening. I hope I have covered many of the blockbuster remedies which becomes handy for the clinical practice in day to day. And I think it may be useful for you in helping those patients who are having some paucity or there is no progression in the case, or for any curative aspects in the case. As an intercurrent remedies, can use all these remedies. Thank you for IFPH platform for giving me this opportunity. Thank you one and all.
Yeah, thank you, Dr. Guru Kiran, for your nice presentation. It was very useful presentation for those rare remedies. You termed it as blockbusters. So those who wish to ask questions, please come forward, raise your hands and ask your questions. Please come forward. Those who wish to ask any questions to Dr. Guru Kiran, please come forward. Dr. Marian Salcedo, please come. Dr. Marian. Yeah.
Hello,
How are
hello
you?
to all of you. Thanks, Dr. Shaji, for this opportunity, and thanks, Dr. Gurukiran. It was an amazing session. It's very important to let us know the blocks that we can face in the homeopathic treatment, and all the points that you review are so valuable for us. I learned a lot. There is a lot of new remedies for me, so I have a lot of homework today. Thank you very much, and thanks for being here. Come always again. Thanks, Dr. Shaji.
Thank you.
Thank you. Others, please come forward. We have 8 more minutes remaining with us. Dr. Hariharan sir. Hariharan sir, please. Hariharan sir. Any comments on the remedies presented by Dr. Gurukiran?
Hello.
Yes, sir.
Hello, Gurukiran.
Yes, sir.
Good evening. Good evening. Good evening.
Good evening, sir.
Very good. Okay. Very glad to see you. Your comments regarding the medicines is it is very nice, and those remedies are very good in our practice. And this folliculinum, this insulin, these are medicines we are using it daily. And now again you come our see me in this webinar with some more remedies. And okay, thank you very much. Very good.
Thank you, sir. Thank you.
Thank you, Hariharan sir. Others? You should make use of this of Dr. M.G. Geeta. Geeta madam, please. Unmute madam. Yes, madam, please. Yes, madam. Okay.
Evening, Dr. Gurukiran. Very nice presentation.
Thank you.
Lot of information about rare remedies. Since morning, I was eagerly waiting to hear this. What you are going to say about this blockbuster remedies while hearing the heading? What you are going to talk about? Regarding this Castor equi, I can add one more point. It is useful in parts of the forehead also. I tried it.
Yes.
I got result.
Okay. Okay. Okay.
Okay.
Thank you, madam.
Thank you, madam. Thank you.
Thank you very
Very
much.
nice.
Very informative talks. Thank you, Doctor.
Dr. Hariharan,
Yes, sir.
see, one of my doubt is that what is the difference between folliculinum and this uforinum? Can you say to me?
Yes, sir. It's a different remedy. Uforinum is also called as ovarianum. Ovarianum. It is different. Folliculum is different. Both are sarcodes only. Hello. Can you able to hear me?
Yeah,
Okay,
you are audible.
yeah.
Please.
Fine. Okay. Yeah. Folliculinum is a sarcode. Again, uforinum is a sarcode. Both the things are different. It has got separate sets of symptoms, uforinum, and also folliculinum. In uforinum, I have also tried in infertility cases where there is blockage. You can think of also uforinum. Also in PCOS case also you can think of uforinum. Both the remedies are different.
Okay, okay. See, I am usually using this uforinum, and I am getting very good
Okay.
result also. That is
Okay.
why I am asking this.
You can also use folliculinum also. It's also a very good remedy.
Very good remedy. But usually I am using the potency is 200.
Okay.
No, you
Okay.
are using lowest potency.
Yes, I am using lowest potency.
Geeta madam, your hand raised is new. Hand raise is new or old one?
Old
Geeta
one.
madam.
I want to ask one more.
Okay, please, ma'am.
And this folliculinum and thyroidnum. Any
Yes.
relation thyroid? Some similarities are there in symptoms.
Madam, I'm not able to hear your last point.
Thyroidinum, medicine thyroidinum and folliculinum.
Yeah, thyroidinum. Yeah, I got it. Yeah.
Some similarities
You
are
want the
there
difference?
in presentation in sexual sphere.
Similarities.
Ah.
Yes, yes, yes. It is there. Especially in sterility cases. In sterility and disability and exhaustion during sexual activity. You can think of this thyroidinum also folliculinum.
Mm.
Yes, you can think of those things.
Geeta madam is my pathology teacher also. Thank
Okay.
you, madam.
I was working in the Department of Pathology,
Yeah,
Government Homeopathic Medical College, Trivandrum.
where I
Okay,
studied
okay.
also.
Where
Okay.
I studied.
Very glad to hear you.
Okay.
Others, please.
Any other inputs as a blockbuster remedies, you can share it so that I can
Yeah.
also learn. Any other blockbuster remedies which can be used extensively in your clinics.
So I request Dr. Mariamma to say vote of thanks to Dr. Gurukiran and we can wind up the session. Dr. Mariamma, can you please? Dr. Marian Sals. Okay. Dr. Mariamma John. Okay, Dr. Mariamma, please. Okay.
Congratulations, doctor. Very nice presentation. On behalf of IFPH, I would like to express my gratitude to you for such a nice presentation. Please come again with another subject. Thank you, doctor.
Thank you. Thank you, one and all.
Okay, so we can wind up. Thank you, Dr. Gurukiran, for your nice presentation. As always, welcome. Again, come with a lot more presentations to educate our fellow homeopathy doctors so that we will be updated. We will be inspired to become better practitioners and with thorough knowledge about our subject. So it is sharing globally, nationally and locally. There is a mission of International Forum for Promoting Homeopathy. So we are a cream of internationally dedicated, passionate homeopathy doctors supporting and helping each other for the future development of homeopathy internationally. So with this, wind up this session. Thank you all. So handing over to Dr. P. Shaila or Dr. Mariamma, whoever be the next moderator. Please come forward. Yeah. Thank you.
Shaji, doctor.
Yeah.